Welcome to the third trimester. In this video, we're going to discuss what to expect for your prenatal appointments between the 28th and the 35th week. In my opinion, this is more of the nesting phase of pregnancy. At this point in time, usually you start feeling a little bigger and a little harder to move around. You also start to feel a lot stronger movements from the baby between the 28th and the 32nd week because the baby is bigger, but there's still a good amount of fluid for the baby to move in. As the pregnancy continues, the baby gets bigger and bigger, and there's less and less fluid, so they may not be as dramatic of movements. The main things we really look at during this part in pregnancy is number 1, your birth plan. Number 2, we do your third trimester labs. And number 3 is your growth ultrasound that we do routinely in our practice. Birth plan is important because it marries a few things. The first is your birth preferences, vaginal delivery versus C-section, also what type of vaginal delivery you would want. Are you someone that desires an unmedicated pregnancy? Are you someone that values a little more control or has social circumstances that would make you favor something like a scheduled induction and everything in between? That has to be married in with your medical and surgical history so we can come up with a appropriate plan that you are happy with but is also safe. We also draw your third trimester labs, which is mostly sexually transmitted disease and whatever other labs are necessary based on your past medical history. The third is the growth ultrasound. The growth ultrasound for us is important because it confirms the position of the baby. It also gives us an idea of the size of the baby and how big the baby will be at birth. Most of these conversations as well are more nesting related, meaning we want to tie off little loose ends that might be lingering. Like, do you have a pediatrician for your baby? Do you have enough support at home? Do you desire to get pregnant again shortly after this pregnancy, or would you like some sort of birth control, and discuss all those options so when the baby comes we have a plan moving forward on how best to serve you.